You're good. Okay, so understanding word parts and how they're going to work together, that's just going to like reinforce those word building skills. Okay. So the easiest way for us to figure out what a word means is going to be by breaking it up by each one of the word parts. Okay. So our different word parts that we have are going to be over on the right-hand side. The word parts are the word root, the combining form, the suffix, and the prefix. Okay. Most of these are going to be of Latin origin. So essentially, we are learning a whole new language. Okay. This is not going to make sense in one day. This is probably not even going to completely 100% make all the sense in the world until we are done with coding. Okay. You're still going to have a ton of questions. You are still going to have a ton of self-doubt and uncertainty. And, so don't feel like midterm is something that you have to know before we move on to the coding portion, the CPC portion. Okay. I'm going to throw a lot of information midterm at you guys for the next 4 weeks, but we're going to still be deciphering all of that into the next 12 weeks of that. Okay. So at the end of the full 16 weeks, then you should have a pretty good understanding of medical terminology, but it's not like you have to completely 100% know everything and be an expert. Okay. By golly, I'm not even an expert at it, right? I still see some things where I'm like, oh my gosh, what is that? Or how do I pronounce that? Or what do I do? And like some of these words are going to look like supercalifragilisticexpialidocious at the end of the day. Okay. You're going to think I'm having to learn a whole nother language, and essentially you are. Okay. We know that there are people that will take a foreign language for 10 years and then finally be fluent. There are going to be some people that take a foreign language and be fluent in a couple of years, in like 2 or 3 years. But it really just depends on each person. So don't feel like, oh, well, Maddie's not asking any questions, so I'm not going to ask any questions today, or whatever. Because chances are, not to pick on you, Maddie, and not to pick on you, Jennifer, but Maddie's probably struggling. She's just like, nope, I'm going to sit over here and I'm going to keep my mouth shut and I'm just going to be lost in silence. So it's one of those things that, it just may not click today, but you could be cooking dinner tomorrow and you're like, oh my gosh, it makes sense. Like it's just going to make sense out of nowhere. Okay. And it may be that you're cooking dinner in a couple of weeks and you're like, I'm still struggling. And then one day, just like in the middle of the night, it's going to click. Okay. The biggest and the hardest part is just remembering that you have these 4 different components of each word. Okay. You have your word root, you have your combining form, you have your suffix, and you have your prefix. Okay. So your word roots, you have a couple hard, steadfast rules. Okay. They can never stand alone. So you will never have a word root that is by itself. When we break it down, you can break it down into multiple word roots in one word, but you always have to have a prefix, a suffix, something along the lines. Like you always have to have a suffix of some kind. Okay. Your word root is going to mean basically that basic meaning of the word. So for example, let's flip back one, that word root that you have here for the stomach. Your word root is going to be gastr, G-A-S-T-R. Okay. So the hypergastritis, that is going to mean like the main part of that word is we are talking about the stomach. Something is going on with the stomach because of that GASTR. So again, your word root, that typically is going to describe the part of the body that's involved. And then our suffixes are going to be placed after, and then our prefixes are going to be placed at the beginning. Okay, so those are just kind of like the 5 simple, like basic rules of word roots.
Mm-hmm.
All right, so moving on to your combining forms. When you have a combining form, it typically is going to include, or it will include, a vowel. Typically, it will be an O. Okay, it's going to be added at the end of a word root, but you will still have that suffix after it. So it's just basically going to help you use that vowel for pronunciation. So when you have 2 combining word roots, then your combining form is going to be added to the first word root and typically not the second. And then your combining form is going to be used at the end of the second word root only if the suffix, and it should be, does not begin with a vowel instead of with a vowel. So if the suffix ends with a vowel, we do not need a word root. Okay, so some examples of our combining forms down at the bottom. You have myelo is going to be spinal cord. Myo is going to be muscle. Osteo is going to be bone. And then arthro is going to be joint. So whenever we say that it aids in pronunciation, this arthra, that's really hard to just stop at arthra. You know, like that, ending a word with thr is very difficult to pronounce, right? So we add that combining vowel there so that it just kind of helps aid in that, it just flows a little bit better. Okay.
So it is spoken like out loud as Milo.
Yes,
or
Milo.
Mayo,
Yep.
or
Yep.
or arthro. Okay.
Yep.
Oh.
Yep. We will actually vocalize those combining forms. Yep. Okay. So moving on to our suffixes. Okay, these are going to be added at the end of a word root to complete that term. So you may indicate with a suffix that it is a procedure, that it's a condition, a disorder, or a disease. So your suffix can pretty much mean pretty much anything and everything, minus the actual like body part itself. So you will also have that combining vowel. So remember this, we talked about the combining vowel with that word root. You'll use that combining vowel when the suffix begins with a consonant, so not a vowel. So you'll see in that word neuroplasty, when you join neuro with a suffix plasty, then we're going to use the combining vowel of the O, because plasty begins with a consonant.
Okay.
But if we have a combining, or if we have a suffix that begins with a vowel, okay, so our last bullet point. So we have tonsillitis. Our suffix is itis, so it starts with an I. So that's going to be a vowel. So we are not going to use the combining vowel O because the suffix begins with a vowel. So it's not going to be tonsillitis. Okay, it's just going to be tonsillitis. We're going to drop the combining vowel at that point. So some examples of our suffixes. They can be a noun, so a person, place, or thing. So the UM is basically going to be like pertaining to, you know, the cranium, so pertaining to the cranial space, the skull, the head. area. You also have your pertaining to, that is an AC. So cardiac is just going to define or describe. You're going to have a few suffixes for abnormal conditions or diseases. So osis. So again, you'll see here that because these all three start with your vowels, then you're not going to use your combining letter, your combining vowel. Okay, so gastrosis, you drop your combining vowel. Here, cardi is going to be the word root. The C-A-R-D-I is the word root. So this I is not a combining vowel. So cardiac, it's not going to be cardioac. It's going to be cardiac. Okay. Your suffix for pathology, you have a couple of them. So algia, itis, and megaly. So pain and suffering, inflammation, and then enlargement. And then you've got some suffixes that will be in relation to procedures. So synthesis, graphy, and scopy. So a arthrocentesis, a colonography is going to be producing a picture or a record of the colon. And then a scopy, so an arthroscopy or arthroscopy is going to be a visual examination of a joint. Okay. So those three main parts, you have your word root, well, four main parts, your word root, and then the combining form, which is going to be your word root with a combining vowel, your prefixes, and your suffixes. Those are, if you can figure out what each of those four are, then you will be able to figure out medical terminology and what a doctor is talking about. Okay. Now, the hard part comes in. Okay, so that was the easy part. The hard part is going to be where all of the special rules and things like that come into play. Okay, so you're going to have different different types of suffixes. So these double R suffixes. Okay, so basically anything that starts with two R's. These are going to be ones that are a little bit more difficult to break down just because they look different and weird and funny, right? But if you finally break it down, so hemorrhage, okay? So our word root is that hemo, well, is the hem, and then the O is the combining vowel. And then the RRHAGE, that's just going to be the loss of a large amount of blood in a short amount of time. So if you have a hemorrhage, it's going to be an excessive or abnormal fluid discharge, and we're talking about the blood. So it just means that we are hemorrhaging blood. We are losing blood, right? Raphe, that's going to be surgical suturing. So if you have myorrhaphy, that's going to be a surgical suturing of a muscle wound. So they're going to go in and actually stitch up that muscle. Diarrhea, that's going to be the frequent flow of loose or watery stools. So the rhea means the flow or discharge of the bodily fluids. And then dia is just through. Okay. And then our rhexis, that's going to be a rupture. So if you have a myorrhexis, then that's just going to be, if we break it down, a rupture of the muscle. Okay, so it kind of helps if you break it down. If I was in a class with you and I had a whiteboard in front of me, then I would be writing out these words and putting slashes in between. But because here I'm able to actually make it color coordinated, then that helps too.
Obviously, it's so fantastic for my end, just by looking at your,
Good. Okay. Now for our prefixes, so we talked about the word root, the combining vowel, and then the suffixes. So I don't know why I didn't put the prefixes at the beginning, but it's fine. It's fine. Everything makes sense in the end. So our prefixes are going to be added at the beginning of a word. They will usually indicate location, time, or number. Okay, they can mean a lot more other things, but these are typically the three things that you'll see majority of the time. So an example is if you have prenatal, which means that it's before birth. So our pre is before, and then birth is the NA, and then the TAL, or the NAT, sorry, the NAT is the birth, and then the AL is pertaining to. So if you see the word prenatal, it is pertaining to before birth. Okay.
Mm-hmm.
So sometimes whenever you break down a medical term, sometimes it makes it a lot more wordy and lengthy, and hence why we have medical terminology, right? Because it's a lot easier to say the prenatal versus, well, the time frame pertaining to before birth. It just flows a lot better to be able to just say everybody just says prenatal, and we know that that's what that means. Okay, so we have some prefixes that you'll see that may have similar spellings, but they mean completely separate things. Okay, so it's very important to make sure that you're paying attention to the letters and where they're placed. So for instance, ab is away from, and then ad is toward. So you'll see an abduction and an adduction. Okay, so make sure, excuse me, that you are paying attention to those, the letters, and where they're placed. And then you have inter and intra. So inter is going to mean between, and then intra is within or beside. So they seem like they're kind of the same things, but really they are different. Okay. So just make sure that you don't think, oh, inter, intra, they mean between, and one means, within. So between and within kind of mean the same thing. So we can just use those interchangeably. Unfortunately, we can't. Okay. So in order to take a word apart, okay, so we have to do a couple of different things. First thing we need to do is we want to separate the word parts. So if you think of it kind of like a puzzle, right? So you actually take those individual, you have oto, which is going to be a word root. You have rhino, which is going to be a word root. Technically, laryngo is going to be a word root, but because our suffix ends with that vowel, or sorry, the suffix begins with a vowel, we're not going to use a combining form. So here we technically have 3 word roots in this one word. And then we have a suffix. So we don't always have to have a prefix, but we always have to have a word root and a suffix. Okay. So, well, I don't want to say always. You can have sometimes a prefix and a suffix and no word root, but it's not going to happen very often. So you can have multiple word roots. So otolaryngology is going to mean ear, nose, and throat. And then our suffix is the study of. So again, it's one of those things that it makes sense if you kind of think of it as those different puzzle pieces. Individually, they all mean one thing. But then whenever we put them all together, it kind of flows very nicely. Now, if we try to add in a combining form after laryngo or after the larynx, and we try to add in this piece that doesn't fit, right? We're going to try to like shove in a piece that doesn't fit there. Then if we try to say otorhinolaryngowawology, that doesn't sound as nice as everything put together properly. So we always want to make sure we're not trying to shove that last puzzle piece in there, that we just want it to, it looks like it fits, but it really doesn't. So if it doesn't flow very nicely, chances are it probably doesn't fit. So again, the first thing is separate each word into its different parts. So our prefixes, our word roots or combining forms, and then our suffixes. And then once you determine the context in which all of those individual terms are done, then like it says there, some of our word parts may have multiple meanings. So depending on the multiple meanings, we might have to say, does it mean this one or does it mean this one? And whichever one makes more sense. Okay. Typically, you will see commonly accepted pronunciation next to the term when we're learning all of these terms. Okay. In the medical terminology book, let's just flip to page 99. Okay. So you'll see table 3.7 or 3-7, the suffixes for your diagnoses. So your first one is going to be your suffix. The second column is your meaning. Your third column is your example. And then right underneath it, it's got your pronunciation. Okay. So your primary emphasis is going to be shown in uppercase letters. And then your secondary emphasis is going to be in lowercase. And then typically they will bold it if there's like a more like that second more than just a normal like whatever. So for instance, your secondary emphasis in appendicitis is going to be pen, but that primary is going to be D, append. Why do I have I don't know where that primary emphasis, I don't know what I pulled that out of. Yes. So your your SIGH is going to be your primary emphasis because it is uppercased. And then your lowercase, if it's bolded, then that's going to be like a secondary emphasis. So appendicitis is going to be, it's not going to be appendicitis. It's going to be appendicitis. So the duh and the tis are going to be kind of like those backwards syllables of the word. Okay. So you do have some unusual rules that apply with our single and our plural endings. So some of our English endings have been adopted for some commonly used terms. Some of them are going to be very weird and very wonky. Okay. So just keep in mind that we will go over those like as we get to the word parts that mean certain things. But just kind of, if you see something that looks a little like, then you'll probably have a couple of those faces every now and then of the, doesn't make sense, but okay, we'll go with it type thing. And then lastly, whenever we're talking about terms and word parts and all of those, you do have some terms that may look and sound familiar or similar, but they are going to mean completely different things. So these are going to be ones that you might want to not just take those out of your stack of flashcards until you really like have gone over them multiple times. So you can see here on the left, arterio, athero, and arthro. Okay. The athero and the arterio usually you'll see those together because you have plaque and that fatty substance within your arteries usually. But then you've got your arthro that is completely separate, and that's a joint. Okay. And then your suffixes, your ectomy, your ostomy, and your otomies. Okay. You'll see these ectomies, ostomies, and otomies a ton when we're in CPT, okay, in our procedures. So that's essentially what these are, is procedure suffixes. So ectomy is the surgical removal. Ostomy is going to be the surgical creation of that artificial opening. So a colostomy bag. And then otomy is just going to mean that they are cutting or they're making a surgical incision. So they all create some sort of opening. But is it the ectomy that we're actually opening and removing something? Is it the ostomy that we're creating an artificial opening that we're not going to close all the way up? Or is it going to be an otomy that we're creating a surgical incision and then at the end we're going to stitch up and be done?